My name is Lina of Indonesia, and I am 13 years old. My father works as a farmhand in another man's field for 15,000 rupiah per day. This is barely enough to provide for his wife and 2 children. In my community, it has been a long-held tradition to marry off girls after they have their first menstruation. And my mother was no different. She was married at 11 years old and had me when she was 12.
I am Kumari Waiba of Nepal. In my community, girls during menstruation are kept hidden in their houses for 22 days. We are not allowed to meet our relatives and friends, and we often miss school, so we eventually drop out.
I am Kathy of Vietnam, and I am a member of the Women's Union of the Ho Chuang Commune. I was just in high school when I had my first child. Family planning methods are not accessible in our community, and women lack the proper information on contraception. Because of this, I almost had a miscarriage, which really harmed my health and my baby as well.
Rural women are the social and economic foundation of rural communities. They care for the family and community and contribute significantly to economic production. The Asian Rural Women's Coalition partners with ARWC to document stories of women who are empowering themselves in claiming ownership of their sexual and reproductive health and rights. Hajara Ben from India has been bestowed with the responsibility of taking care of her siblings and doing housework since she was very young.
I was already cooking for our family since I was 10 years old. I have never been to school. Boys were privileged to be sent to school. Girls had the responsibility to do the housework and take care of the siblings while my parents are out working for a living.
These women are often spoken about but not heard enough, especially when it comes to their sexual and reproductive health and rights. Mai is a mother and a worker at a garment factory in Thailand. Originally from Kochao village in Myanmar, Mai has been living in Mae Sot, a border town in Thailand for the past 14 years. Women in the agricultural sector also experience the harsh economic and working conditions experienced by women workers. Therese Miabe, a woman farmer from the village of Pandin in Senegal, explains the ill effects of the use of pesticides.
Food crops treated with pesticides contain residues which can cause cancer and affect pregnant women. Miscarriages are common among women producers who apply pesticides on crops.
My name is Mrs. A. Bhavani. When I first went to villages as a community health worker, I found out that there was a lack of health care and medical facilities and no information on family planning methods. In spite of having children every year, they do not realize that they are oppressed, suppressed, and discriminated. Women are treated like slaves.
I am Deepnandani of Uttar Pradesh, India. Perched amidst forests and hills, our village is a remote one, without any means of transportation, coupled with minimal government facilities. Clean drinking water is hard to find. Women and girls walk beyond 150 meters to avail of the basic facility of clean drinking water for their families.
My name is Halima Bil. I'm a mother of 10, but only 7 of my children are alive. Most of the time, even if we tell our husbands not to have intercourse, they do not listen. Closely spaced births, exposure to pesticides, and undernourishment all possibly contributed to the deaths of my 3 children. We do not have very good food. Whatever meager amount is available, we survive on that.
It was only when a women's rights organization came to their village that Halima realized and learned that one can stop having children. She also started participating in various village programs and is now working with Roots for Equity.
I know what our rights are now. I know not only the inequality between men and women, but also the inequality that is created between landlords and haris. We do not have our own land. If we had our own land, then we would have grown food according to our needs and would have fed our children well.
Cherendolgor Shagdar, a 48-year-old mother of 5, lives in the rural town in Mongolia. Her mother was a doctor, but she became a victim of hospital neglect herself. In the journal, she told of the painful story about her 4th daughter in 1995. During that time, everyone watched the first popular television series. So when her daughter was born, the people in the delivery room accidentally hit her daughter's head on the sink because they were hurrying to watch the series. Her daughter had a hemorrhage. Today, 19 years later, her daughter suffers from brain damage. She has also gone blind in one eye, while the other eye doesn't function well. Cherendolgor observes that generally, there is a high level of child and maternal mortality and injury because of hospital errors in her area. Tahira Nas from Pakistan, on the other hand, had to defend her basic right to education.
I was in the last year of a private lady health worker course when my father died. It had always been my father's wish for his daughters to receive education, but the people in the village opposed my education. When I became a lady health worker, people complained to my elder brother that women were supposed to stay at home. I asked my brother, so what is wrong if I am able to help out other women? Women are the only ones who can put an end to their own miseries.
Rural women have empowered themselves by working with one another and organizing themselves to better advocate women's rights and needs in the different sectors. 42-year-old PK Chamila Tushari shares the unique experience of creating an outlet for women workers in the Katonayake Free Trade Zone to express themselves and share information through a newsletter. Chamila has been a member of the Dabindo Collective, a local partner organization of Women and Media Collective, for the past 2 decades. She is responsible for coordinating and preparing articles for the Dabindo newsletter and distributing it among women working in the Katonayake Free Trade Zone.
I am Hosne Ara Hasi of Bangladesh. As a young girl, I was shy and afraid to talk about my menstruation with anybody. I did not know what it was, so I hid it, and I got an infection.
but did not get treatment. This gave me the idea to take the lead in providing proper knowledge and support to adolescent girls and young women on their reproductive health. I founded the organization Jagonari that works on raising awareness of local women on their sexual and reproductive health and rights. Jagonari has 80 adolescent clubs who organize group meetings to impart knowledge to young girls on their menstruation, nutrition, and their reproductive health rights.
Poverty is also the main reason for women being forced to have sexual intercourse for food. They call it survival sex. A report cites evidence that in Africa, women who lack sufficient food are 70% less likely to perceive personal control in sexual relationships, 50% more likely to engage in intergenerational sex, 70% more likely to have unprotected sex, and 80% more likely to engage in survival sex than women receiving adequate nutrition.
Poverty among women is particularly high in Lokosa. Women's status does not allow them to make personal decisions without the approval of their husbands. The age difference between men and women during marriage heightens the domination of men over women. This does not only mortgage the health of women, but also their economic future.
This situation among rural women often leads them to dangerous work and unsafe food sources. But this also gives them the strength and commitment to take the lead in organizing and educating other women to fight for their rights and the rights of their family and community.
As a worker's wife, I had a hard time budgeting the meager income of my husband from working for Lepanto Consolidated Mining to be able to meet the daily needs of my family. This is because of the harsh exploitation by the company of its workers.
The difficult economic situation in Lilian's family and community pushed her to join the workers' movement. In 2003 and 2005, the workers of Lepanto Consolidated Mining Company launched a strike.
I was then breastfeeding my 8-month-old child, but I managed to go to the picket line every day to support the protest. The workers protested the unjust compensation for the long hours of work. The police and the military threatened us and even threw away the rice supply of the people in the barricade.
These women's voices are not resolutely and significantly carried forward to policymakers, nor do policymakers seek them out. In September 2000, world leaders came together at United Nations headquarters in New York to adopt the United Nations Millennium Declaration. This has become known as the Millennium Development Goals, a global partnership to reduce extreme poverty and setting out a series of time-bound targets with a deadline of 2015. Initially, sexual and reproductive health rights was left out of the MDG framework, but having realized that sexual and reproductive health and rights are interlinked with all key development agendas, MDG 5B, or the phrase, achieve universal access to reproductive health, was only added as a goal in 2005. In the recent years, the growth in religious and political conservatism and fundamentalism across countries leads to the rollback of significant policy successes in the sexual and reproductive health rights agenda.
Our organization, the Association of Women Teachers Development CATI, aims to improve literacy and spread awareness on HIV/AIDS and finally fight a practice that has endangered girls and women for decades: female circumcision. This practice involves partial or total removal of the external female genitalia.
In a report on female genital mutilation published by the United Nations Children's Fund in 2013, it was reported that 89% of women and girls in Mali have undergone circumcision. In Asia, however, another sexual tradition exists.
Many families in my community still practice the sexual custom of vagina breakthrough, wherein girls aged 12 undergo a prepubertal rite of passage and have their vagina broken through by an older, sexually experienced man. This is against the willingness of the girls, but it is seen as a necessary act which enables adolescent girls' bodies to mature into adulthood. This practice later leads to unwanted pregnancies, sexual violence, mental illnesses, and sexually transmitted illnesses such as HIV and AIDS.
According to a report by ARWC, gender inequality may deny women the opportunity to negotiate for safe sex, or may force women and girls into abusive transactional sexual relationships in order to obtain food and other necessities. Many women don't have the power to decide when they will have sex or to demand that their partner use a condom.
In our community in Mono and Kufo, the prevalence rate of HIV/AIDS on pregnant women was estimated at 7.6% in Mono and an average of 3.6% in Kufo in 2000.
An estimated 33 million people worldwide were infected with HIV and AIDS as of 2007. Women represent 60% of new infections in sub-Saharan Africa, and globally, HIV is the leading cause of death in women of reproductive age. The Rural Women's Traveling Journal is an effort to ensure that any action plans around sexual and reproductive health and rights beyond 2015 will take into account the voices from the Southern women and young people and their lived realities. The 2015 Sexual and Reproductive Health and Rights Action Plan must be done in line with existing international commitments and conventions, with particular focus on the marginalized groups. We call on governments and the international community
to ensure universality of sexual and reproductive rights,
to strive for universal access to sexual and reproductive health and rights, information and services,
to ensure sound accountability mechanisms,
to review and implement laws and policies,
to generate evidence through gender-sensitive research,
to address effects of religious extremism and increased vulnerabilities to climate change, migration, disasters, poverty, and food insecurity.
We want to be heard.
Listen.